So the first approach to answer this question is to have, let's say, a theoretical approach which consists in the adaptation of the data that we have about the pathogenesis of the disease in humans. In humans, it's well known that this bacteria has a specific, let's say, interest or tropism for the genital tract, leading, as I showed you before, leading to abortion, especially in pregnant women for sure, with chronic infection, okay? And we can also, let's say, suspect or collect clinical signs in ruminants associated with Q fever based on field observation. So it means that you are facing abortion or premature delivery. For example, you make a diagnosis and you consider that this is Q fever, so this is more or less a good way to approach the fact that Q fever could lead to reproductive disorders, okay? So what we can find today, especially in the human, this is what they call the EPS and W, and if we adapt that on cattle, it could mean that Q fever could theoretically be associated with the occurrence of abortion and then retained placenta or metritis, but at this stage, we don't know if this is the infection per se, which is responsible for retained placenta or metritis, or is it just a consequence of abortion, which is well known as a risk factor for retained placenta and metritis. But for sure, for any pathogens leading to abortion, you can have also premature delivery and stillbirth, or more generally, weak calf syndrome. And other signs are very frequently reported or suspected by the practitioner on the field, consisted in metritis, retained placenta, fertility disorders, and respiratory disorders. Okay. So from a theoretical point of view, what do we have, especially regarding the link between the bacteria and genital tract? So we have first an invasion and possibly localization in the placenta. The first possibility, and probably the most frequent one, is the immediate clearance of the infection, leading as a most likely outcome to a normal offspring, if for sure we don't have a co-infection with another abortive pathogens. And if we have an establishment of the infection, so which means that we don't have immediate clearance, we have once again both possibilities. The first one, is the implementation of a latent infection. And if this infection has a limited spread, the most likely outcome, once again, is normal offspring. If there is a spread of the bacteria to the fetus, once again, two possibilities, still a latent infection with, once again, most likely outcome normal offspring. So it means that in a lot of situations, the infection of a pregnant animals could lead to a normal delivery. But if we have an active infection, for sure we can have a normal offspring, but at that time we can have as a possible outcome either an abortion, a premature delivery, stillbirth, or weak calf syndrome, okay? The same if from the beginning we have an active infection. Once again, it will depend on where the bacteria will spread. We can have a clearance, for sure, but depending on the localization, if the spread of the bacteria is through blood, or if we have a transplacental spread, we can expect a different kind of clinical signs, for sure, mainly abortion, depending if yes or no, the infection is localized, disseminated or not, okay? So this is, let's say, a theoretical flow diagram of what could happen within a cow or within a sheep, a goat, a pregnant animal. What could we expect after the infection through this bacteria, okay, with this bacteria.